welcome back to the Nursing Genre YouTube channel. In this video, I'm gonna teach you a condition called Raynaud disease. In brief, I'm gonna explain about the definition, types, causes, risk factors, clinical features, diagnosis, management, prevention, and complications. Definition: Raynaud syndrome or a disease is a disorder that affects small blood vessels in your fingers and toes. It may also affect blood vessels in your nose, lips, or earlobes, causing episodic spasms called vasospastic attacks in response to cold temperatures or stress. That means if people with Raynaud disease gets exposed to cold weather, it causes reduced blood flow to the fingers, toes, and sometimes other parts of the body. Next one, types. There are two types of Raynaud disease, primary Raynaud and secondary Raynaud. Primary Raynaud, also called Raynaud disease, this most common form is in the result of any other medical condition. It can be so mild that many people with primary Raynaud don't seek treatment and it can go away on its own. That means primary Raynaud is in the result of any condition and it is mild and it does not need any treatment. In secondary Raynaud, also called Raynaud Phenomenon, this form develops because of another health condition. Although secondary Raynaud is less common than primary form, it tends to be more serious. That means it occurs due to other medical conditions and it tends to be more serious. Let's see the causes. First one, connective tissue diseases. For example, lupus erythematosus, rheumatoid arthritis, and etc. Next one, diseases of the arteries. That means these diseases causes buildup of fatty deposits in the blood vessels that feed the heart and a disorder in which the blood vessels of the hands and feet becomes inflamed. Next one, carpal tunnel syndrome. It causes numbness and pain in the hand due to the pressure on a major nerve to the hand. Next one, repeated actions or vibrations like typing, playing piano, or doing movements like that for long periods can cause overuse injuries. Smoking, injuries to the hands or feet, for example, include a wrist fracture, surgery, or frostbite, etc. Using certain medications causes this Raynaud disease. For example, using medications for attention or deficit or hyperactivity disorder medications, some migraine medications, high blood pressure medications, certain cancer medications, and some cold medicines. These causes Raynaud disease. And now risk factors of Raynaud disease. For primary Raynaud disease, sex. That means it causes or it affects more women than men. Age. It occurs in between the age of 15 to 30. Climate. It affects people living in colder climates and people having family history may affect them. Next one, for secondary Raynaud, certain diseases or any other primary medical conditions, due to any primary medical conditions, you may get this disease, and certain jobs that includes repeated trauma or repeated actions or vibrations and using certain substances causes this disease. Next one, clinical features. You may see the following in Raynaud disease: cold fingers or toes, or area of the skin that turn white then blue. Depending on your skin color, these colors may change, may be harder or easier to see. And also you may feel numb or prickly or also stinging upon warming or stress relief. And also in severe cases, you may see sores on the finger pads. In rare cases, you can see gangrene in the fingers that causes infection or needs amputation. Diagnosis. The first one, nail fold capillaroscopy. In this test, they may place a drop of oil on your skin at the base of your fingernail to see whether your capillaries or your smaller arteries are enlarged or abnormal. To see that action, they may order this test called ninefold capillaroscopy and also anti-nuclear antibody tests to check for autoimmune diseases, and also complete blood count test, ESR test, erythrocyte sedimentation rate to detect any inflammation in your body, and also urine analysis, pulse volume recording, and also they may check this rheumatoid factor for autoimmune diseases. These are the diagnostic features or diagnostic evaluations. Next one, management. The management will depend upon your symptoms, your age, and your general health or general condition, and also it depends on how severe the condition is. There is no known cure for Raynaud's phenomenon, but your symptoms can be managed with the correct treatment. Your treatment may include calcium channel blockers. They may help to your blood vessels to get relaxed and to open up, and also alpha blockers. These will do constrict your blood vessels, and nitroglycerin skin ointment, it can be applied to your fingers to help your skin ulcers. Prevention. How can you prevent this Raynaud's disease? You should limit exposure to the cold or cold weathers, cold temperatures, and also you should keep yourself warm with gloves, socks, scarf and a hat. You should quit smoking, and also you should wear finger guards or fingers with sores. You have to avoid things like repeated actions or to prevent trauma or vibrations to the hand, and also you should take blood pressure medications during the winter to help reduce blood vessel constriction. So this is about the condition called Raynaud's disease. Thanks for watching this video. Consider like, share and subscribe to this channel, The Nursing Genre. Do watch other content in this channel that helps your studies. Thank you.